It's low in fat, high in vitamin C. Apparently, Frank says his daughter Alison suffered from eczema, tried a skin cream made from the product, and it really, really helped. Researchers from Kazakhstan, where the drink is hugely popular, said horse milk can help reduce the risk of cancer.
It has got an odd smell.
It smells of horse?
No, it always smells like...
What's it smell of, then? She said coconut, Josie, yesterday.
No, it's like...
Oh, I can't swallow.
It's like salmon.
Oh!
It's got
fishy horse.
Sort of fishy horse.
Oh, stop it. Go on, then. Go on, get it down. Get it down.
See, I don't like milk.
Get it down.
At the best of times. I drink oat milk.
Oh, my God. What are you doing then? Why are you doing this? I said no.
I don't like that. Don't like that.
What does it taste of?
It is sort of coconut, but it's quite watery. It's got a bit of an odd feel to it. A bit of a strange taste.
Cool, your eyes are watering.
I mean,
Does it taste like milk?
It's got a bit of an aftertaste.
Does it taste like milk?
Not really.
We're not into the horse milk thing at the moment.
I'm not into that, and I'm sure there are many people who are.
There are. In Kazakhstan.
In Kazakhstan, there you go.
Dr. Nikat is here now to go through today's health headlines, but obviously we have to ask you first. Horse milk, what do you think about that? Would you recommend it?
I mean, I never thought I'd be asked. So how do I follow after that? I mean, that's amazing. Well done, Phil. You're very, very brave for doing that.
He's a brave
and are we thinking that there may be health benefits?
Well, it is a very popular drink in Kazakhstan, and there's actually evidence from various studies that have been done that it can reduce cancer. And actually, people who are allergic to cow's milk, this is a great alternative. But if it's got an aftertaste, I don't know how many people would be willing to do that. They'd rather go for your option of oat milk or soya milk.
Listen, that's just me. It's just me that gets that. Josie tasted it yesterday.
She thought it was
tasted
lovely.
The coconut.
Yeah.
She loved it. That's just me. And maybe it's not because I'm a massive milk fan.
No,
Maybe
exactly. You were not the best person to try. Anyway, let's move on.
So here we go with this fiasco in Europe again. France's President Macron, Italian Prime Minister Mario Draghi say that they would promptly restart the administration of the AstraZeneca vaccine if it was cleared by the European Medicines Agency tomorrow. This is a statement by the EMA, who's the one they're talking about, said there was no sign the vaccination had caused blood clots. The European regulator said it was firmly convinced that the benefits of the vaccine outweighed the risks. So here we go. You've got a whole bunch of people in Europe who are frightened to take it now because of what their leaders have said, bearing in mind that they've got form on this, that Macron and Merkel both said that it was ineffective in the older population in Europe, and then backtracked immediately on that and said, you know, no, you should take it. What this is doing, all this is doing, is not only there, but here, is putting people off taking this vaccine.
And it's putting lives at risk, because we know that one way out of lockdown, this is going to be driving down the numbers of COVID-19, is going to be a vaccination programme. We need to be able to give the confidence. We need to be able to reassure our patients. And I, as a doctor, who I'm actually actively vaccinating, I'm doing a vaccination clinic this Thursday where I'm administering Oxford AstraZeneca vaccine. I need, as a clinician, to be sure that what I'm giving my patient is safe, because I'm an advocate for my patients. So this also is putting healthcare professionals in a bit of a tiz, because we're worried about giving something that could have side effects. The most important thing is that there is no evidence that it causes there's links to clots. Yesterday you had Professor Kappelman and Dr. Ranj, and the World Health Organization, the Medical Health Regulatory Authority, and also the European Medicines Agency. They've all said there's no categorical link at the minute. Please, if you're called for your vaccine, go. It is safe.
OK, thank you. Bottom line, it's safe. So a year of lockdown, this is another headline, has aged our brain. Oh, gosh, yesterday we were talking about tweakments that our faces have aged by 5 years, and now our brain has aged too.
This is a really interesting study that's being done by Professor Loveday at University of Westminster, where she's saying that actually, because of the monotonous and repetitiveness of our life, that we can find that we're losing memory cells, and we walk into a room and forget why we're in there. But actually, I've been working and I still walk into a room and I'm like, I don't know why I'm here. So it's happening to a lot of us. It's because the hippocampus bit of our area, the bit of our brain, needs stimulation. So all those little office chit chats or small talks that we make, they actually improve our verbal literacy and our verbal fluency as well. So little things that people can do to improve their memory is to do quizzes all those people that said they were going to learn a language, actually that's quite good. That will get your memory cells up, as well as making sure that you are having those little conversations with people.
There's hope for more than 1 million eczema patients from an arthritis drug which has also been used to treat COVID-19.
Wow.
Yeah, so this is actually really interesting because it's a medication that we're still trialling out. And actually, we know that over 1 million people suffer from eczema. And this, the drug has gone out of my brain. So
it's actually called baricitinib.
Baricitinib is the drug that we're giving people in order to assist their eczema as well. And if it works, it's still in the trial period, but if it works, about 80,000 people will have loads of benefits from this. So the trials are still happening, but it'll be a great thing if it does work.
Yeah, that's a really good one, isn't it? This is slightly worrying. Women are less likely to seek treatment for heart problems. Why?
There's a twofold answers to this. Women actually present slightly differently with heart risks. I've done a very small tutorial on TikTok about this. About 1 in 13 women actually suffer from cardiovascular disease. And historically, we've always seen cardiovascular disease or heart attacks more common in men. And so we always associate that with men as well. So men will get the typical chest pain, almost feeling like there's an elephant on their chest. Women get quite these subtle signs. So they might get a shoulder ache, a jaw pain, flu-like symptoms as well. So this is why actually there's a twofold. One, women don't realise that that could be heart-related. And secondly, there's possibility that doctors are missing those signs. So it's raising awareness in regards to actually we cannot just have all these studies which have been done on men in regards to heart attack and just say, well, women feel exactly the same. What we need to do is actually show that women have slightly different atypical chest pain signs. And the American Heart Association have done lots and lots of promotion around it. And there's lots of promotion from the British Heart Foundation, making sure that we're picking up these numbers, because obviously it's devastating if you miss a heart attack in a woman.
Just finally, a powerful hallucinogenic drug known for its part in shamanic rituals is being trialled as a potential cure for depression for the first time.
How incredible.
It's incredible because actually we know that they are trying lots of hallucinogenic drugs. DMT is the medication that they're trying, and it needs to be done in conjunction with talking therapy as well. So it's not just something that can be given on its own. That doesn't mean that everybody going out have recreational drugs. Please don't do that. We do lots of other studies in regards to making sure it could be part of the treatment, because mental health and depression needs to be dealt with properly.
And also, we should point out that we've been reporting for many years on here that some recreational drugs can actually cause depression.
Of course. Particularly marijuana can make hallucinations, paranoia, depression far, far worse.
All right. Thank you very much
Good
indeed.
To see you.
Thank you. Right, still to come, we're joining Clodagh in